2020 continues. Once again, Elizabeth Vargas.
It's a prettier picture inside American mouths these days. Cavities are down, the use of teeth whiteners is up, and dentists are now giving consumers what they want, the perfect smile. But before you buy into an extreme mouth makeover, ABC's John Quinones has something you should see.
When you're smiling, when you're smiling, when you're smiling, when you're smiling, and the whole world smiles.
There's no denying the importance of a smile, especially a dazzling one. And nowadays, just about anyone can have those picture-perfect teeth. They're temporary snap-ons for a celebrity look. These are called the Gwyneths, as in Paltrow.
That's a fantastic look for you.
Oh, I like those.
You do?
I love the color.
These are a little larger.
And can you guess which famous grin she's wearing now?
Let's see them.
You've got it, Julia Roberts. But you cannot eat with these snap-on teeth. For that, you need something more permanent, like veneers, made popular by makeover shows.
Remember a month ago? Check her smile now.
I've got my smile back, thank you.
These success stories are all you generally hear about. What you don't hear are the veneer disasters.
You know, I just wanted to enhance, that's all. Just enhance the smile.
Suzanne Brown never smiled, even in her modeling days, because she didn't think her teeth were very attractive. She opted for veneers, which provide a thin shell of porcelain, almost like a faked fingernail, on the front surfaces of the teeth. They can hide a myriad of problems. In her case, minor gaps.
I know when you go to the dentist, you're going to have some pain. You take a couple of Tylenol and that's it. But I was in pain for over a month.
So this is serious pain.
Yeah.
And here's why. Just take a look at Suzanne's badly infected gums.
The problem with her is that the restorations just didn't fit.
Dr. Ronald Goldstein is a leading expert in the field of cosmetic dentistry.
It had to be a perfect fit. If it sticks out from the tooth, then the gum can't heal properly, and bacteria get in, and there's disease, and functionally it's a disaster. Much better.
It's taken a whole year of treatment to get Suzanne's gums back in shape, but they won't fully heal until each of those 18 laminates have been replaced. Problems like Suzanne's are all too familiar to Dr. Goldstein, who sees them when patients come in seeking help.
How big a problem is it?
I would say between $10 and $12 billion a year. It's staggering.
Look at these pictures of jobs gone wrong. Pictures you won't see on any makeover show. You're not supposed to be able to tell that any work was done here. But how could you miss the obvious unnatural edges in this tooth bonding job? And these pus pockets in another patient formed when badly fitting veneers caused infection. And get a load of this $15,000 veneer job. It looks more like the before picture than the after. And then there's this man. You're supposed to have 2 front teeth. He wound up with 3.
Dentistry is an art and a science. You can't just have the art, you can't just have the science. It's a combination of both.
Gosh, you always want to keep that fresh, youthful look forever, right?
Cindy Fowler's problems with her veneer job began almost as soon as the work was done.
I was just miserable. I was sitting there with my hand over my mouth. I couldn't drink anything. It hurt to talk. Everything hurt. And I kept thinking, oh, this will go away. This will go away.
But it didn't go away. And Cindy soon noticed something else.
I could see cracks in my teeth.
So you're looking at the mirror and you see suddenly cracks in your teeth.
Cracks in my teeth.
When Cindy went to Dr. Goldstein's office for help, she found out something even more upsetting, something most people may not be aware of. Her teeth had been aggressively ground down to apply the laminates. This is all that's left.
You don't know what will happen in the future. When you have this much tooth matter taken away, it's irrevocable. They can't put it back.
While many dentists use this aggressive technique, the experts we spoke to say it's often unnecessary and can lead to extreme sensitivity and even root canals. And when the teeth are filed down this way, experts say the veneers may not last as long.
don't have sufficient enamel left to be able to hold the porcelain.
The dental office responsible for Cindy's veneers say that both tooth decay and prior work made that tooth reduction necessary. And they claim that faulty adhesive materials may be to blame for the cracks. But the experts we spoke with say they can see no reason for that much reduction. Keep in mind that veneers cost on average about $2,500 per tooth and last about 10 years. It's a lifetime commitment. Which is why some experts are incensed at the veneer job done on this woman when she was just 18 years old. Almost all her teeth were veneered, and they were ground down so much that she soon needed 5 root canals, stabilizing posts, and crowns to replace her front teeth.
And when you start doing this at a young age, think about how many times they're going to have it done. So the more conservative we can be, and the longer we can get that restoration to last, the patient benefits, and that's what we want to do.
So while veneers can do wonders to brighten your smile and your life, a skilled dentist is key. But don't rely solely on ads when making that choice, because any dentist can claim they're a cosmetic specialist. There's no certification needed. And as for those enticing after pictures you might see on the walls and in albums in the dentist's office, well, it turns out they can be very easy to come by.
We had this gum specialist, who has never done cosmetic work before, place an order on the internet. And sure enough, he got a batch of before and after pictures of patients that he never worked on. They even came in this engraved album, complete with a sample cover letter that could easily lead you to believe that the work is his. So be sure to do your homework and ask who did the dental makeovers. Otherwise, you could end up with a look and a smile you never bargained for, and a mouthful of very bad work.